My name is Roger Hartl. I'm a professor of neurosurgery at Weill Cornell Medicine and New York Presbyterian in New York. And I'm the leader of the Weill Cornell Medicine Project in global neurosurgery, especially spine surgery and head trauma in Dar es Salaam, Tanzania. We're in the operating room in Dar es Salaam right now, and I want to tell you a little bit about the work that we've been doing over the last 3 days and what the particular interventions and surgeries have been that we've been working on. We have a meeting here every year. We spend at least 1 week here teaching and training surgeons, and then we also get involved with some of the surgical cases, and we do spinal cases, we do brain cases. A case that we did yesterday, for example, that was very fascinating and very interesting was a minimally invasive spine case. This is something that we do in New York a lot, of course. Minimally invasive spinal surgery has become a very, very important part of what we do for our patients. And it turns out that it is also very important in infrastructure limited regions like here, because minimally invasive surgery is associated with a very low infection rate, and the complications of this type of surgery are much lower. So we're trying to really focus on some of the minimally invasive surgery here, because surgeons particularly here in Dar es Salaam and East Africa can benefit from some of those procedures. And yesterday we did one of our first minimally invasive spine cases here in a patient with a severe nerve compression case with severe lumbar spinal stenosis, and the patient did very well. Today we have a surgeon here from Palestine who is a world-recognized expert in scoliosis surgery, and he's doing scoliosis surgery with the local surgeons here, which is quite a difficult undertaking. But they're doing a great job. I was just in the operating room, and the patient is doing really well. So we're working on various projects. We just had a meeting about the work that we do in the intensive care unit here. The intensive care unit is becoming increasingly important because a lot of the patients that they take care of are very sick patients, and they require intensive care unit care. We're helping them with protocols, we're helping them with teaching and training the nurses and the physicians to make sure that they can actually adequately and safely and effectively take care of these sometimes very, very sick patients. So overall, it's been a great week. There has been a lot of progress over the last year. We keep up to date with weekly calls, and so we're constantly in touch. But it is important to be here, of course, in person, to have that one-on-one interaction and to really be able to see exactly how things are progressing on the ground here. And it's been a great week.